We'll be talking about our senior center here in town and some of the survey results that may have come out from that. So with no further ado, introduce Chief Armstrong. Okay, and Chief, you're going to give us an update.
I am. Good evening, everyone, and thank you for having me. I have several different items to go through for you tonight. Kind of broke it up by individual divisions within the organization. But before I start, I guess it's been quite a year and a half for me coming in. I think we've made some tremendous strides in moving our department forward, and we certainly didn't do that by ourselves. So, you know, I'd just like to thank all the men and women of Littleton Fire Rescue, our command staff, our fire partners in Highlands Ranch and the Littleton Fire Protection District, as well as the council and the city manager, and our internal service providers, our HR department, IT, and finance that help us with all our initiatives. So we would have never accomplished the things we did without their assistance, so that's important. So coming in the door, I had two major initiatives that we needed to take on. One of them was planned and one of them wasn't. The one that was planned was our standard of cover and our master plan for emergency services, looking out 15, 20 years into the future. Where are we going to be and where do we go and how do we get there? The other was ISO, who called me about 3 days after I got here and said, "Hey, Chief, welcome to town. We're coming to visit." And we immediately had to put it into high gear and do a lot of work. I'm going to talk a little bit about that, but some of the major undertakings that we had to look at was our pre-fire plans of all of our businesses and our response areas, as well as our documentation for our training hours for all our firefighters. Everybody understands the importance of keeping our ISO rating as low as possible to keep our insurance costs down for our business owners. So that was a real important undertaking for us that we were very successful with. We did some reorganization in the department. I came in and we had a couple positions that we evaluated very closely, our safety and training officers. We felt that we weren't really getting the return on investment that we wanted for those positions. So we initiated a reorganization and helped beef up our training division and move those individuals to a Monday through Friday shift. And they're working out of our training center and doing a very good job for us. And we're going to talk a little bit later on about some of the things that we're doing in our training division, and that was all accomplished as a result of that reorganization. Well, we made several moves in the fire department. We made a new fire marshal not long after my arrival, new training chief, new logistics chief, and recently made a new operations chief. So with that comes a lot of changes, and moving it forward, trying to develop a new culture in the fire service, looking at how do we do things differently, is really one of the things that I've been really pushing on our command staff and our firefighters. You know, getting rid of our box and not thinking outside the box, but not owning one, and really asking a lot of questions why. Children all the time ask the question, why do I have to go to bed and why do I have to go to school? And I think as adults we don't ask that question enough. I always ask why. Why do we do it this way? Is there a better way? What's the efficiency? So I think that's really kind of taken hold in the culture, especially with some of the changes. And I think we're seeing a lot of positive results because of that. We also, some of the reorganization also called for our administrative staff to move our office locations and bring our Fire Prevention Bureau down here, which helped create the city's one-stop shop. We knew that that was important for our citizens to give them a place where they can handle all their permits and plan reviews in one space, and we were happy to be able to help get that accomplished. Since I came here, we've had several people leave from retirements. One recently was our EMS division chief with almost 42 years of service. So we have some tenured people that are starting to move on and start new chapters in their lives, and as a result of that, in the last year and a half, we've actually conducted 10 promotional exams. Chief Tasker always says that I'm breaking the record for giving the most exams in 1 year. So I'm actually proud of that, but as a result, we've promoted 12 new officers in our organization at various levels, lieutenants, chief officers, captains. We've hired and trained 12 new recruits, and we still have current vacancies that we need to fill, so we're seeing a lot of that turnover. And we've retired approximately 10 members. So a lot of that, too, is helping us move that culture and that organization in a new direction. There's new vision, and there's a new energy and enthusiasm in the department that's really moving us in the right places.
How many in the total department?
We have 132 members online in the field running emergency services, and then we have approximately another 28 that are administrative staff, fire prevention, training, and emergency communications. So in addition to the reorganization, promotions, and retirements, we've made some huge improvements on our capital, thanks to the support of our council as well. We've taken receipt of 2 new Pierce fire trucks in the last year and a half, recently acquired a new Pierce ladder truck, 2 medic units, with 2 more expected this year. We're working in the process of ordering a new battalion chief vehicle as well as 2 new quick cars. In addition to that, we purchased over $800,000 worth of new air packs for our emergency responders. They're state-of-the-art air packs. We've taken delivery of them, inventoried them. We're just completing all the training, and later this week we'll be putting those new breathing apparatus on all our fire trucks. And that brings us up to the new standard, NFPA standard for breathing apparatus, so we have the state-of-the-art equipment that's available for our firefighters to ensure their safety. Some of our training initiatives that we've taken on, we have created a new officer development program. We felt that was really important. We noticed through our promotional exams and evaluating our system that we use, we have some succession planning in place where we allow people to act up in higher positions, and they get paid for doing that. That keeps our costs down in terms of overtime. But there was a disconnect in the standards that we were applying to the people that were promoted in positions and the people that were using as actors. And what we've been able to do is streamline the standards to make them the same for the position. My philosophy is it doesn't matter if you sit in the position for a seat or you sit in the seat for a day or you sit in the seat permanently. The job is the same, therefore the training requirements and the standards should be the same. So we created an 80-hour officer development program that all our officers are required to attend in order to be eligible for promotion in the future. We've done the same thing with our engineer program, making sure that we're putting some good standards in place for the safety of our people and our community. We completed over 45,000 hours of training. ISO requires us to conduct 20 hours of training per person per month in order to maintain our current ISO rating. And in 2014, we completed about 45,000, just over 45,000 hours of training. And we do it in various topics such as fire suppression, officer development, engineer, special operations such as hazardous materials, wildland firefighting, swift water, and ice rescue. So we run a whole gamut of different types of training programs. And we have now implemented the ability to track our training hours so that when ISO comes and visits, we just hit a button and print out a report, and we can show them all the information that they need. But we're very proud of that. Our primary mission in the fire service is to respond to emergencies, and our second mission is to make sure we have well-trained firefighters, and I'm very confident that we're meeting that mission. Prevention and public education has done quite a bit. The one-stop shop has really helped streamline some of our processes, and we're continuing to work with our building department to make sure that look at opportunities to share software and make that process for our community as simple and streamlined as possible. We completed over 1,100 plan reviews in just 2014, 1,370 fire inspections our Prevention Bureau conducted of businesses. Our firefighters went out and conducted over 2,000 pre-fire plans of all the businesses. The pre-fire plans are basically the fire truck will show up at a business, they'll introduce themselves to the business owner, and we kind of walk through and we do a diagram of the business, we look at what things they're storing there. Our firefighters kind of conduct a pre-plan of what would we do if this business was on fire, where are our means of access, where are our means of egress, what hazardous materials might be stored here, what cautions do we need to be aware of. the Knox box keys work so we can gain access if we need to. And that's required by ISO, and we conducted a pre-fire plan of every business in our response jurisdiction in 2014, and something that will continue for the future. It's required by ISO. So the first year was quite an undertaking because the department really hadn't done pre-fire plans in the past. So we really had to start from the ground floor, which was quite interesting. We had to develop some software to see how we would build that, and then the introduction of the consolidated CAD, where we're sharing information with other departments, required us to enter in the information the same way as every other department, so it's usable across all jurisdictions. So it presented some challenges for us, and it was quite a bit of work for our firefighters, but when we asked them to step up to the plate and take on the hard work, they got it done, and we're very proud of that. So that was really important for us in terms of being able to pre-plan how do we respond to a fire in different locations in our jurisdiction, and was really good training for our firefighters as well. Yes?
Do you need to do that every year?
We do it every single year, yeah.
Okay. So if there, sometime between your inspections, if there's business and changes, are you alerted to that?
Yeah, so our prevention bureau is alerted to that through the permitting process and the plan review. So that gets on their radar right away out of the gate. Until that address is due for an inspection again, we wouldn't go out and do a pre-fire plan. But once the pre-fire plan was done on the new occupancy, we would go into our records management system and we would update the emergency contact information and any other pertinent information in terms of what's being stored there, what's the business used for. So that's why we do it every year, to make sure that we're staying up on that as much as possible. And last but not least was our public education events. We participated in over 130 public education events just in 2014 alone, and we interacted with more than 4,600 of our citizens in terms of public education. A lot of them are school children. We participate in the meet and greets that you all host, as well as the ice cream social and Highlands Ranch. So we have quite a bit that we do. The fire muster that's going to be coming up, we'll be participating in that. We're going to have quite a few static displays out there and a lot of our new apparatus on display. So we're really proud of our ability to get out with the public and see the public and interact with them and let them kind of educate them on who their fire department is and the services that we're here to provide them. In communications, we had quite a bit going on in our dispatch center. We went through a major overhaul of our dispatch center with radio and console upgrades. Most of that was appropriated through the 911 authority. Really brought us into the 21st century in terms of the technology and the capabilities that we're utilizing in our dispatch center. The dispatchers are our frontline people in terms of receiving the 911 calls and getting our firefighters out the door. So they're an intricate part of our service delivery. Additionally, we have the text to 911 installed. I'm not sure if that's completely up and running yet, but that's just kind of a wave of the future, some of the possibilities of emergency services. I was actually reading an article recently where, they were throwing out a hypothetical and the using of technology and social media in handling emergency responses. And they gave the example of an individual sitting in his home having chest pain who sits down on the couch and can't really get to the phone, but texts 911, and the dispatch center gets it, uses GPS to identify where their phone is, dispatches emergency services to that location, sends out an email through a social media site that people can subscribe to where a neighbor might get notified of the emergency a couple doors down. And then they have software programs that will identify where the closest AED is, and then therein treating the patient as we're arriving on scene. So we're moving in that direction where we're looking at technology and how we can use that to make us more efficient in our services. And this was a big step forward, upgrading the radio consoles and using the text to 911 system. So in addition, we launched a consolidated CAD system, our JAC system, that we're sharing with South Metro Fire Rescue, West Metro, Evergreen, and a few other departments. It has presented a few challenges for us that we're still working through. It was a major system change We didn't expect it to go through without any snags, and we've run into a few, but we're handling the challenges as they come, and it hasn't really impacted our service delivery to the point where we're overly concerned. But it was a major undertaking. It was a lot of work. A lot of our staff put in long hours trying to get that system up and running and did a very good job. Improvements in our service delivery is something that, I personally am pretty proud of. The utilization of quick cars. Late in 2014, we started implementing the concept of using quick cars where we put an EMT and a paramedic on a rapid response vehicle or a Tahoe type of vehicle, and we send them to various types of incidences that would not normally require large apparatus like a fire truck or a medic unit. Things like fire alarms, motor vehicle accidents with no known injuries, carbon monoxide alarms, things like that. The quick cars are a culture change for the fire department, so while we're utilizing them and we're getting the bang for the buck we hoped for, it's come with its challenges because firefighters at the end of the day don't sign up to work Monday through Friday. So other than the hours, we're seeing that the cars are actually working very well. We're not necessarily getting the full result we would like to. If you remember when we initiated the concept, we took some of the existing staff that we had and we put them on the cars, and we didn't want to incur any extra overtime liability. So when those members take time off, we actually shut the cars down and then utilize that staff to put them back on fire trucks. But because of that, we're actually seeing that they're not in service as much as we'd like them to. So they're not having as great an impact as we would like to see them. So as I explained back in 2014, it's probably a program we're going to want to look to change and enhance and possibly even expand in the future because we think they have a lot of value in our service. We were very careful in how we implemented the program. We identified first of all, we brought a bunch of our firefighters together. We wanted to get buy-in on the program, and we asked them about the concept, and they helped us develop what the response model would look like. We identified several different calls that we would send them on, and we used technology like GIS mapping to identify where those calls were occurring so we would know where to place those units in service. And it's worked out very well. We're changing the model as we go. We're identifying what areas are working and what areas need improvement. And we're actually moving more towards a system status management model with these cars as opposed to putting them in one district. When they know that Station 11, both units, the engine and the medic are out and that nobody's in that district for a first response, they're actually heading in that direction so that we can cut down the emergency response for the next call. So we're using it to try to enhance our response times, but we need to really see them in service more often to get really the impact that we're hoping for. But they are working very well, and we're going to continue with that program. The other one that we had launched that we're very proud of is our CARES car. The CARES car is our mid-level vehicle with a community paramedic on it, as well as a physician assistant. What we use is that car is for field referrals. So if we run a patient who has, let's say, a nosebleed, rather than transport, we can refer them to the care car, and the PA will actually come to the patient's house and treat them right on scene. So it's reducing our transports of non-emergent patients, which keeps our emergency vehicles more available for emergency responses. The community loves it because they don't have to leave their house. We had one patient who fell and hit her head, and she needed some stitches. Our PA showed up at the house, sutured her up, went on their way, and went back several days later and removed the sutures. And she was just amazed that she didn't have to go to the hospital for that. So we're really proud of that program. Mobile integrated health is a huge undertaking that a lot of departments and municipalities are looking at in the future. We felt very strongly it was the right thing to do for our community. It was the right service to provide them, and we're very proud of it, and it's working very well. We've actually expanded the program with our CARES car that we'll actually see some of our city employees. If they're ill and they live in our response area, we're actually doing house calls to some of our city employees. So it's actually an excellent program, and it's being very well received not only by the public but also by our employees. And with that care car, we've taken some really proactive steps to move it along in the right direction. We partnered with Centura Healthcare as well as Arapahoe Community College, and the three of us together are actually bringing the community healthcare paramedic curriculum to ACC, where we'll fire departments in our area will be able to send their paramedics, and they'll be able to get the actual training that they need. There is no place for any paramedics to get this community healthcare paramedic curriculum locally, and we're very proud of the fact that we're initiating that locally here with our partners. We're currently in discussions with Cigna Health Insurance. They're very interested in partnering with us and contracting services with us so we can actually recoup some of the costs when we run calls on Cigna healthcare patients. We'll have the opportunity to bill them for the services, and Cigna's agreed that under certain circumstances they'll be able to reimburse us for some of those services. So it's a step in the right direction to help us get the funding that we need to sustain that program for the long haul. United is also another healthcare provider that we're having conversations with about contracting services with us. As the word got around with our care car, several entities have contacted us and wanted to know more about it. Windcrest and Holly Creek are two assisted living facilities that were very interested. They use our services quite a bit. We're sending our medic units and fire trucks there quite often. They're very interested in the services we can provide, and they're also interested in contracting services with us where they might be able to call the PA instead of 911. So we know that, you know, we've always been, the fire service has always been an organization that's really never said no. If you don't know who to call, you call 911. And our motto is, if you call, we show up. We pull cats out of trees. We do water leaks when their pipes freeze. They don't call plumbers, they call the fire service, and we always show up. But the downside of that is we've kind of created this monster. So we keep running all these calls that are really non-emergent, utilizing our emergency resources. And we can't take the non-emergent calls out of the system. All we can do is change the way we respond to them. And I think we've done a good job with that with some of these programs that we've initiated. We had, yes?
So in Cigna and so forth, so are we looking at total cost recovery and in providing things that normally they would pay for?
Well, I don't think it's going to be total cost recovery. We're still in negotiations with them on what that would look like, but similar to our EMS billing, we would determine a rate that would be acceptable for us in terms of the services we provide that they would reimburse us for.
Thank you.
We had two major incidences just recently. We had 2 3-alarm structure fires locally here right off of Federal. They were very close together. Really put a strain on our system because they were very large fires. They utilized quite a few of our resources for long periods of time. Happy to report that there were no fatalities or injuries in either one of those fires in terms of citizens or our firefighters. Those are really the 2 major incidences that we've had, and really the last year and a half, everything else has been pretty much status quo. EMS calls you typically dominate our responses. But those were 2 large fires that were quite significant for our municipality, and our firefighters did an excellent job, and with the help of mutual aid from our neighbors, they came in and provided us aid, and we were able to mitigate those situations. In terms of some of our workloads and stats, I wanted to give you an idea of some of the data and the statistics and the analysis that we're looking at. I'm kind of a numbers guy. I like looking at the numbers. I don't like operating in theory. I like operating in data. I think it helps me justify what our needs are moving forward and how well we're doing our job, and gives you the information that you need to make the decisions that you make on our behalf. So some of our workload stats is that Littleton Fire Rescue has really seen a steady increase in our workload. Since 2009, we're seeing our incident call volume increase 16.5%. The good news is that our fire responses have decreased 1.3% annually. So we're seeing our fire incidences actually decrease, and 63% of our calls are EMS in nature. So we're really predominantly an EMS delivery system. We do fire suppression. Obviously, fire suppression is that low incident, high risk work that we do. It's dangerous work. It's very physical and demanding on our firefighters. Generally, that's where our injuries would occur, our significant injuries. But the good news is that our fire responses are down. Our EMS incidences have increased 8.8% over the past 5 years, or 2.2% annually. And our medical transports are really going up. April of 2015, we had more transports than the previous 15 months. We had over 500 transports in 1 month. That's obviously utilizing a lot of our resources. It takes our medic units a long time to get on scene, evaluate the patient, drive to the hospital, hand the patient off to proper care at the hospital, and get back to their district to run another call. So as our call volume increases, we're faced with more challenges to get our units to scenes timely. We're working really well to get that done, but the trend is that our transports are increasing quite a bit. In 2013, we saw about 6,200 transports. In 2014, we saw about 6,800. So we saw quite a bit difference in that 1 year, and we're expecting that trend to continue upward. Our unit hour utilization rate, or our UHU, is a measurement that we try to use to identify how busy our trucks are. We measure our UHUs as it's a mathematical formula of how much time do we spend running calls versus how many hours in a year are we in service. And in order for us to hit our response time, so for example, if we have a 7-minute response time 90% of the time, our units have to be available at least 90% of the time to meet that standard. And when we calculated out our unit hour utilization rates for all 5 of our medic units, we're exceeding the 10% already. So once we exceed the 10%, we can't hit the 90th percentile. So we're struggling with that. The good news is we run ALS engines. They help us pick up that workload. But we are seeing those trends go upward because of the increase in call volume. The last thing for me that I wanted to just touch on with you is our master plan. We're currently, we're just about at the point where we're getting ready to wrap up our master plan with ESCI, our consultant that came in to help us. We launched this several months ago. It's been quite an undertaking. I have participated in several community meetings where the meetings were facilitated by ESCI. We brought the community in by invitation, and we asked them a lot of questions. First, I gave them an education on Littleton Fire Rescue, what we do, our size of our department, the type of services we provide, our response times. And then we asked them a lot of questions about what do you want from your fire department? What do you expect from your fire department? Based on what you've heard, do you think we're providing the right services? If you had to prioritize the services that we were providing, how would you prioritize them? And we took all that information and used it in our strategic planning process. Myself, along with 19 other staff members, went down to Colorado Springs for 2.5 days, and we embarked on a strategic planning session for the fire department, part of our master plan. And in that, we were able to identify a new mission statement, new vision statement, new core values for our organization, as well as 11 policy initiatives that we'll attempt to accomplish over the next 5 years. We should be ready to roll that out here very shortly. The master plan, we've worked very hard with our fire partners to get to a point where we can look at our service delivery. Where are we today? Where do we want to go? How do we get to a point where we feel we're providing the best level of service at the lowest possible cost for our citizens? I'm a big believer that our responsibility doesn't end with patient care. It also looks at the fiscal management of our fire department and what is the cost for our citizens. So I think we got to a point where the city, as well as our fire partners, are happy with the outcome of that master plan. I think everybody is finally on board. It was quite an undertaking because everybody has different needs and different I guess, desires, and, we're not completely on the same page, but we're working very well together. The communities are different, they have different needs, so to try to bring that all together and get everybody on the same page where everybody's getting something that benefits their community while cost sharing was quite an undertaking. But I think that our partnership has really blossomed over the 1.5 years that I've been here. I feel very, very confident that we have a strong relationship with our fire partners moving forward. I think they're committed to the department and some of the recommendations I'm making in that master plan. So my hope is that we can get that finalized here very soon and get it rolled out to you as well as the other 2 boards for adoption, because one of the things that was really important to us is that, it had to make fiscal sense. And it had to be actionable. We didn't want to put something in there that we couldn't actually accomplish, and we didn't want a study that we weren't going to do anything with. So I think that everybody's happy in the direction that we're going, and I think there's a commitment by everybody to move forward with what we have. So we're pretty excited about that, and I'm eager to get that rolled out. So that's really the update that I have for you, but I'd be happy to entertain any questions you may have.
Bruce?
Chief, thank you very much. I've got about 3 questions and then a comment. The training location, what do you see going on with in the future? How's that working out? Is it cost effective? What about the existing space that the city still owns that's the training location and that kind of thing?
Yeah, so we use our existing space quite frequently. Our training officers are housed there. They have offices there. I like that facility because it's close to home. If I have the need to pull our crews out of training to respond to calls, I have the ability to do that. It lacks some of the things that we're able to achieve with the South Metro training facility, but it's so far removed from our response jurisdiction, I'm really hesitant to use it. We use it when we have to, but we try to keep our training close to home. Where we end up with that down the road is unknown at this point. We are working through some ownership things. As you know, West Metro and South Metro are no longer active participants at the training center. We actually have some Tabor money we requested in our budget for 2015 to make some improvements at that location, but I'm hesitant to make that investment because we lose 75% of our money as soon as we do that. With the joint ownership and not knowing what the end looks like for everybody. So we're going to continue to explore what our options are there, and in the meantime, we're using the facility, not to the level we would really like to, but it's very effective for our workforce.
And you know there are people that would quickly, if you were to say you didn't want it, have another need for it, so yeah. You need to really make it be known if it's needed for you so that we know how to proceed on some of these other plans.
I think it's safe to say we want it.
Yeah. Absolutely.
I agree.
Second question is, over the years, the feds had a lot of different ways of giving grant money. UASI was one of them that was Denver-wide. And so things like self-contained breathing apparatus and consolidation and that kind of thing, and rebuilding dispatch and communications and those things, is that money available anymore?
The UASI funds are still available. They're on a limited basis. They generally prioritize what kind of projects they're going to budget for, so we look at that very regularly. We did apply recently for an AFG grant for over $700,000 for new mobile Motorola radios that ours are going to be needing to be replaced, so we are attempting that. We've done some grants for life packs through state grants. To date, we haven't been overly successful. We did get a 50-50 match state grant on a $30,000 life pack recently that we put on our care car. So we only paid $15,000 and the state paid the other half, which was really nice. I'm a big believer in grants, and I go after all the money I possibly can. We filled out a grant application with FPPA, who was doing some firefighter safety initiatives where we're looking for extractors for our firefighters to be able to properly clean their bunker gear after a structure fire. We've read all the articles about cancer in the fire service. That's in the forefront of our minds. Unfortunately, a lot of that money went to volunteer departments that have smaller budgets than we do, but we're actively seeking grants on a regular basis.
Okay, third question, the dispatch area, it is what it is. Can it still handle the kinds of expansion and electronic changes and the things that you're trying to do?
Yeah, I think it's accommodated the expansion very well. Right now, I think that with our call volume, and I can't speak for PD, I know that they run quite a few calls as well, but in terms of our needs, our dispatch center is fulfilling our current needs.
And then just the comment that I had was the mobile integrated health initiatives that you're doing on the different levels, they're going to change the cost structure. It would not be fair to look at how we did things over the last 5 years, because that really changes it all. And with the community that we have aging and the expectation of health issues, it may be that the way the money needs to be allocated is justifiably different and maybe even more expensive because of the additional demand. And I think that's something that maybe council needs to learn about as we start to look at that. And that's why K is the second part of the presentation, is what the seniors mean for the community. So just a comment.
Jerry?
Thanks, Chief. Great update. Appreciate it. Regarding the quick cars, I realize that the program is a very valuable program and it's very dynamic on how to make it work. And you're going to budget for 2 more vehicles, is that what you said?
I think initially what we want to do, and this is outlined in our master plan, is expand the existing cars. So when we did our analysis of when and where we needed to deploy the vehicles, we recognized that we're equally busy on weekends as we are during the week. But because we had to pick a time that fit in financially for the city, putting employees on work weeks, we picked 40 hours during the week. So we put them in service from 9 to 5, Monday through Friday. But we're missing the weekends. And the weekends are critical for us because that's when our firefighters do their special operations training. That's when they do their hazardous materials training, their swift water training, wildland training. And that's training that's difficult to recall our people from and send them to a call. So it's putting a strain kind of on the system when we look at it that way. So I think rather than adding 2 more cars, our goal is really to expand the program from Monday through Friday from 9 to 5 to 7 days a week, 12 hours a day. What that'll do is it'll capture our entire busy time, which is from 9 a.m. to 9 p.m., and all 7 days of the week that are equally busy. In order to do that, I have to have 6 people to staff those 2 trucks. They would work 4 12-hour days with 4 days off, and then the other individuals. So that includes the relief staffing, so we don't see a spike in overtime. In the master plan, we are presenting some options. I can hire several people at an X dollar amount, or I can use the relief staffing as overtime, which reduces our overall costs.
Then how does the CARES car work with that? Are they working together?
No, the CARES car is just, it's separate, and we fund, and we have one person that's assigned to that car. We have several people that are able to fill that vacancy if that individual's off that day. And any overtime that's incurred with that car is taken from our EMS enterprise fund. We have 6 PAs that rotate, so that car is operated completely separate.
Yep. No questions. So then on the training facility, did Inglewood also participate at that facility with us?
Yes.
And what, are they going to continue to do some training there with us?
We still need to have conversations, but Inglewood is really no longer Inglewood Fire. They're Denver Fire. Denver is really not stated. I think that they're really not interested. They have their own training facility. We really need to sit down and have conversations with them as well as the other owners to see what the future looks like for that facility.
Well, as you said, the logistics of it is right there where you can train and go to a response. Last question then. So do you anticipate, in lieu of the Inglewood-Denver agreement, do you anticipate any new areas of coverage that you're going to maybe have to be more on alert for? Because I know you guys all, I realize that you have each other's backs, of course, but is this going to change anything there?
No, it shouldn't. We have mutual aid agreements with Denver, so they only call us if they need us. Same, they'll provide us aid if we need it, and we'll call them if they need it. And same with Denver Health, who's providing the EMS services.
Are any of the Inglewood stations close to our border?
There's a couple of them close to the border. The one on the north end is the one that closed. The nice thing about mutual aid is when people call, we get to evaluate what resources we have and make a determination whether we can help them or not.
Thank you, Chief. Well done.
Okay. Other council questions? I have a few. Year and a half you've been here. How does Littleton Fire and Rescue work with Southwest, Denver, the folks that are around us?
I think we all work phenomenally together. We have good relationships with them. We do a lot of training together with them, so everybody's trained at the same level. I think that's really what makes it work, so I think it's all a very good relationship.
Okay. Second is with the ACA and ACOs, recognizing readmissions is an issue for hospitals. Is that what's maybe allowing for or an expansion into some of the space where there's a little more mobile health care being provided?
I don't really think so. You know, when we talked with the hospital, helped us develop our business plan for our CARES car, and they were not overly concerned with readmission rates. They felt that was not going to be overly significant. I think this is just kind of like we saw in the the 1970s when EMS hit the fire service. This is just another expansion of the fire service. It's another leg of something else we're going to be able to do. And really what we're doing is we're filling the void. The idea is that if we respond using a care car, we don't use emergency resources. We don't fill the emergency rooms with people that don't need to be there, so the people that do need to be there get the timely care that they need. And we're filling a gap in terms of the needs of our community. They call 911 because they don't have a primary care physician, and they think that a ride to the hospital is the only alternative. And what we're saying is it's not the only alternative. We're providing you a new one. And, our goal is to provide that immediate 24 to 48-hour gap and then navigate them to where they need to be and get them into the healthcare system that's going to help them the best.
Great. Question kind of came up with home grow facilities for marijuana. Any observations?
I know there's been a lot of discussion about the hash oil legislation and whatnot. We have not had any incidences in Littleton or any of our response areas, so it hasn't been an issue for us, but it is something that we're going to continue to watch.
Okay. And then following up on Councilmember Bruce's comments with regard our aging population and leading into some of Kay's piece, increasing calls related at all, or since you're into kind of the geeky numbers with regard our demographics of our population and what may turn over time?
Yeah, I haven't really delved into the data on that to look at, the age population of where our calls are occurring, but it's something that we know we have an elderly population that we respond to. And, I'm not really sure what kind of effect that's having on our responses. We haven't got that deep into the data yet.
If I may, let me just go back to the, the non-emergent services we're providing. And we are certainly, I think, on the cutting edge, as Chris mentioned, the chief mentioned, but it's True North is running out of South Metro. Colorado Springs is running this. City of Longmont just recently put it into place. And that's just in Colorado. I think you're going to see this. It is catching like wildfire, no pun intended with the chief being here, across the nation. This is a service that has not been met. I think it ties into the overall cost of health care. It is a substantial way to actually reduce healthcare costs on a national level because we're not taking the most expensive taxi to the most expensive hotel room anymore. We're treating that person, and that $3,500 insurance bill or higher may only be a $500 or $600 insurance bill. So how much one of the challenges we're running into, the chief mentioned, we're doing these direct contracts because in Colorado we don't have a billing system for this, so we can't bill for it at this point. Other states have different situations, so we're doing direct contracts with the full service insurance carriers. So the beneficiaries of that are primarily going to be the insurance companies because you and I will continue to pay our same premiums. But the big kind of elephant in the room that we need to take on is Medicare and Medicaid in terms of how we bill at the federal level and how the federal government reimburses. And that's going to take much longer time, I think, from the folks that we're talking about. The momentum that's growing across the nation will help us because it's not just these small pockets of places. It truly is going to be in front of us or in front of the nation, I think, quickly. So I think it's great what the chief's done, and that's I would like to end on. The chief has done an incredible amount of work in a short amount of time. This council is cognizant of the conversations we've had, my desire of what the department should be, and I'm proud to say that I think the chief has taken us there, and we're now moving in the direction we need to be moving. We got a great staff. Those promotions he spoke of earlier are fantastic, and we appreciate the folks that retired for their service and then allowed all these promotions to occur. So there's a lot of happy staffers at this point. So thanks, Chief. Appreciate all your work.
Thank you very much, Chief. Okay, Council, let's take a 5-minute break. Allow Kay to kind of set up. So.
Great job.
On schedule?
What is it? I'll check it out. Thank you.
Okay. Council, I think everyone's had an opportunity to probably have some conversation with Kay Wilmesher over the years.
Great job.
And so, Kay, it's your show.
Thank you. That's a hard act to follow, that fire department, so let's see what I can do. Good evening, everyone. As council hopefully will recall, for a couple of years ago, we began doing research and implementation of programs that could help not only the city of Littleton, but the citizens of Littleton, to help us all prepare for what is expected to be a large increase in needs for our older population. And I'm speaking of the baby boomers, those folks born between 1946 and 1964. A couple of the first projects that we worked on were surveys. One of them called the Community Assessment Survey on Older Adults, otherwise known as CASOA, as well as the Boomer Bond Assessment Tool. Both of these surveys were made possible through DRCOG. We worked with them on them. DRCOG is actively helping a number of communities within their region explore getting ready for the change in population. And it's actually going on statewide and nationwide. Everybody's looking into this. What we found when we looked at the outcomes from both surveys was that the most helpful information we saw in there came at a county level, and that most of the information pointed to services that the county was providing, as well as the state and the federal government, and nonprofits. And it was very clear to us that we do not need to provide those services. They're already in place. We were really happy that we participated in the surveys, though, because they keep us cognizant or gave us the information that we need to know as we move forward, particularly as we're helping our partners and working with them on the addressing the needs. But it was also actually really helpful for another project, which I want to talk about right now, which is our new Aging Well Resource Center, AWRC. And I just want to throw out, before I go any farther, I want to make sure, Council, that you know that I'm not asking for anything tonight. This is informational, and it's an update on the center. How'd I do that? Does that sound pretty good? So the Aging Well Resource Center, known as the Cube, if anybody has been by there, it really is a glass cube. It's located inside Bemis Library. We opened it in September last year. We are open 20 hours per week, Monday through Friday, 4 hours a day. We have a fantastic employee working in there, Debbie, who just happens to be getting her master's degree in gerontology. So she knows just about everything. For the summer, we close our doors on Fridays because we're taking our show on the road, and we're setting up a booth at partner locations and handing out our information there. At the center, we provide resources and referral information for anybody over 50, although we don't turn people away who are younger, but we can get information about just about anything: transportation, healthcare, recreation, mental health. If we don't have it, we can find it, and we consider ourselves to be the experts at finding the experts. Debbie and I have had an amazingly fun time developing the center. Neither one of us have done it before, obviously, so we've just had a blast. And we're really proud of the things that we've accomplished to date, and the top one especially, that we have had contact with over 600 citizens. The fire department had contact with a few more, but this is through on-site visits as well as our events, email, and telephone calls. We have sponsored T-Socials, which we have right outside our door at the center. They were much more popular when it was really cold outside for the seniors. But basically what we do is we provide tea and coffee and refreshments, and people can stop by for information, or they can come back and ask information. And we typically attach that to Bemis Library's afternoon program that they have once a month, which is heavily attended by seniors. So we're totally trying to grab them as they're walking by. We have done these socials with some of our partners, like Meals on Wheels in South Suburban, as well as Arapahoe Community College. They did a little presentation, and the folks really liked that. We held our first event in March called Senior Living Options, where we talked about senior living options, as well as Social Security, Medicare, and Medicaid. And it was well attended, and it was a lot of fun. We are now participating in community outreach outside our doors. We went to Littleton Retreat. Also, recent senior fairs at Doctor's Care and South Suburban, the Buck Center, and then Mission Hills Food Banks. One thing that's so interesting in working with older folks is that they don't actually have to need anything, but when they hear that we're there and we'll be there when they need them, they get so excited. The other thing is, a lot of times when we do things, I'll have a plant out on the table, and they can enter the plant, or a chocolate bar, depending on the weather. And when they win, and you call them and you tell them, it's like they won the lottery. I did? They're so excited. And then I usually hand deliver it, so that's a big deal. Before I go forward, because what I want to do now is talk about some of the trends that we're seeing and the resources that people are coming in and asking for. The categories that we've made for collecting our data are very much a trial run. When we opened the center, we created them, and so some things may not look like they fit in the place where we've put them, but bringing all this information together for the PowerPoint has helped, and we'll be making some changes going forward. So the most common requests, I picked the top 6, and they are housing, 29%, social services, 16%, transportation, 16%, medical, 11%, insurance, 10%, and home services, 9%. Other includes questions about cancer, stroke, vision, recreation, the Buck Center lunches, that kind of thing. I thought it might be interesting to just briefly give you an example of each of those categories. For housing, a majority of our questions are about aging in place, which is very much about caregiving, and it's medical as well as non-medical, people coming in who need help with that, as well as senior living options like assisted living and independent living, those kinds of things. Also, a lot of questions about rentals. Folks who can afford to rent oftentimes are looking to move, or their rent has been raised and they're trying to find another place. And then South Metro Housing Options is a common request as well for their properties. For social services, we do have a few people coming in for light housekeeping and chore help. Many more, I would say, coming in for help with food and utilities, financial help, that kind of thing. Transportation, a large percent, actually all 3 of these are very, very close, or about 25% each within that category. Omnibus being a little bit more popular in that folks are using that to get to food banks and doctor appointments, as well as other place that they're going. Anyhow, with First Ride, it's very similar to what Omnibus is doing, but it's going outside of the city limits. And then Shopping Cart is for the regular shopping trips that folks are going on. Medical tends to be mostly mental health requests. So people are coming in, a lot of times we will recommend to them that they would like to maybe take some information for Arapahoe Douglas Mental Health Network. They're very upset and need help. And an equal number of people who are coming in who are concerned about somebody that they love. And then another another bigger percentage of that, I would say, is Senior Reach, which is another smaller program that we implemented here at the city in the past year, which is a call center program for helping seniors in need. The insurance category is mostly Medicare. Lots and lots of questions about Medicare, and then some other insurance questions will come up. And then for home services, this one is a tricky one. Heavy housework help. Linda knows because I call her at least once a month asking if she has anybody. But yard work, heavy yard work, and then snow removal. And
Kay,
yes.
would you like to just take a moment and introduce Linda?
I'm traveling incognito today, can't you tell my wig and my...
No, you're not.
Linda Haley's with the county.
Right, and so
Yes, sir.
since you mentioned a lot of the CASOA information is related to county services, so just to mention, Linda's here.
That's her, right there, that's her. This year at the Resource Center, we took over Snow Squad, which the city's been running for a number of years. We had 10 volunteers this year, bless their hearts. Several of them took on up to 2 or 3 different homes to shovel snow for. However, we had about 20 people on a waiting list. So that's a big need and something that we hope to do something about in the future. We also keep track of all of the pieces of literature leaving the racks out front. We realize it's a highly non-scientific process of tracking those, as there's a lot of kids running by that see pretty colors and want all of the matching brochures. But on the whole, what's interesting is it is actually very similar to the folks that are coming in and what they're asking for. In general, item 1 and 2 are switched. Medical and transportation, 3 and 4 are switched. Insurance is in the 5th place for both of them. And then Alzheimer's information and home services are in 6th place there. But we're really proud that we have 2,300 pieces of literature being taken while we're gone. We like to think that we have a good reach, that people are getting a lot of information from us, whether we're there or not. So, looking ahead, just without a doubt, we need to get information out. That comes up over and over in all of the surveys and in talking to people, that people just don't know where the resources are and who has them and how to get to them. Not only do we need to be sharing what the resources are out in the community, but we also need to be telling everybody who we are at the Resource Center, because they can come in there to get more information and direction. We also want more people to know about the omnibus and the shopping cart. More marketing for us, more educational events and outreach is what we're planning. Also, we're doing some collaborative work with other city departments, with the fire department and the police department and the neighborhood services folks in community development, in an attempt to reach the people that they're working with and get more resources to them. And then last but not least, we really would like to build some sort of a volunteer network to help with the heavy household work and yard work and snow removal. We're working with a few churches on that right now. Fingers crossed that might come together. So that's an update on the center. Does anyone have any questions?
Council? A couple things that somewhat got hit on a little bit in the leadership retreat, as well is the mental health side and the sense of isolation that folks want to avoid. Do you see being able to hook people up and kind of give them a partner or someone to check on them and hook them up with their neighbors, or how is that working at all?
We've talked about it. It's something that we wish we could do. I feel like in most of the conversations, so many people just can't be reached because they stay at home and they don't leave because of health reasons, and they don't want people to know that they're hurting and so on. We don't have a good way to connect to the people who are isolated. The Senior Reach program is supposed to help with that. You can train anybody in the community to notice somebody in distress or someone who's been cut off and may need help. And the idea is that the person calls the Senior Reach hotline. That person then if permission is given, we'll call the senior and engage them in a conversation, which usually lasts about 45 minutes. So it takes a special person to man that call center. But it's an evidence-based program, and that's why, because they engage them, and then they get the resources and the contact and the outside world to come to the senior, instead of just passing on phone numbers to the senior. So I'd say that's probably the closest we've come to implementing a program. Other than that, we're just trying as much as we can to work by word of mouth and get the word out through marketing. A lot of the Littleton Report has reached a lot of people in Littleton. I'm surprised at how many people call and will stop by and say, we saw your thing in the Littleton Report, and we made the second page. We usually see an increase right after it comes out. So.
And then I know that you and Deb are equipped to have folks that might have some time to actually volunteer that may be in the targeted age range as well. How's that working, and do you get that often enough?
When we first opened, we had a lot of people stop by who wanted to volunteer in our center. We get those occasionally. I guess it's sort of like other volunteer positions. Some of those people will follow through. If we're talking about volunteering in our center, they all have to have a background check, which nobody has any problem doing. It's just following through with the paperwork and that kind of thing. If not volunteering at our center, we have a number of places that we can refer people to do that. I don't see it as often as I did when we first opened, which I can't say why. But I'll tell you, so many of the people that come in the door, I suggest it to them. Because I'll have people milling around outside, like a gentleman a couple months ago, and I said, well, come on in, and he came in, and he ended up talking to me and telling me about his situation, which was really quite sad, but he was very isolated and very cut off. And I recommended, I said, you should volunteer in the library, because he was saying how much he loved books, and the museum, and all these other places, and he hasn't come back, but we try to encourage just about everybody that we talk to, and we've got things hanging on our walls there.
Council, other? Bill?
I just wondered, is there any tendency of these seniors to call 911 when what they really need?
Oh, yeah.
And how have you thought of how to solve that? Is there a way for dispatch to refer them to you or to them?
Yeah, I think that they do that. We have the chief, I'm meeting with the chief of police and the chief of fire week after next, because we want to know more about that care car,
Yeah.
and the other one as well, and figure out how to help the folks that are calling quite frequently, but just to get our information to them for any call that they're making at all. So I do think that there are a lot of people that could benefit from what we're doing. We just want to help everybody, but it's so hard to get to them. So.
And then, not a question for you, but a statement for others, is the House Bill 1033 passed in the latest legislative session, which is, I think it's roughly $250,000 being set aside for a strategic plan on the state level to say how we're going to deal with what is the hydraulics of folks that are moving through the system that are a little bit older, and it's kind of stay tuned. And I'm kind of excited about this because, as with some other issues, sometimes it's too easy for legislators to just ignore the issue until it becomes a crisis, and maybe we'll be a little bit ahead of this one. Who knows? So, I didn't know if Linda wanted to say anything at all. So,
I'm just here to listen.
okay. So, thank you, Kay. Others?
Thank you.
Yeah. Thank you, and appreciate the work that you and Deb are doing, because I've talked to some folks that say you're just, between the two of you, you're wonderful to talk with. So,
Great. Well, and come by and see us if you haven't been there. We're not open very often. No, I'm just kidding. We're open 4 hours a day. But come by and see us when we're open.
Thanks, Kate.
Thank you.
thank you. And council, just a quick note, not meeting next week, and hope everyone has an opportunity to travel safe for those of you that are traveling, and continue to pay some attention to what is going on. And then the following week is our session, but then we also are not meeting on the 30th, so one more session this week.
Study session?
Yes, study session this month. So, thank you, and with that, we're adjourned.